Hi, my name's Nia. Welcome to the Chronic Notebooks YouTube channel. Today I'm going to be talking all about Ehlers Danlos Syndrome and all the different types. So, what will we be covering? So, we're going to talk about loads of different things, and generally, this content page is the same formula that I'm going to be using when it comes to exploring loads of different chronic illnesses and health conditions. So, what is it? The symptoms, less known symptoms, pictures of certain symptoms, talking about the affected populations, how you get diagnosed, and things which may arise in terms of complications, as well as research which is being done on the condition which is emerging and places to look to for some information and support like charities and advocates. So let's begin. What is Ehlers-Danlos syndrome, right? So I have EDS and I get asked a lot, what is EDS? What does that mean? Ehlers-Danlos syndromes are essentially inherited, they are genetic, and they are inherited connective tissue disorders. Now, they're often characterized by hyperextensibility, laxity, and hypermobility of the connective tissue in the body. Now, that basically means that your connective tissue, which is the thing really that holds your body together, so that can include ligaments, muscles, tendons, blood vessels, lining of your gut, which is why we in EDS loads of different types of these body systems can be affected. Essentially, these connective tissue are overstretchy, over elastic, which of course is going to cause a lot of different symptoms. So there are 13 types um, known currently. And hypermobility Ehlers-Danlos syndrome is the most common type. Research kind of suggests that around 80% of people with EDS have this type, but there are other rare types. Now, it's important to say that rare types can be genetically tested for, whereas for HEDS or hypermobility Ehlers-Danlos syndrome, there's no current gene identified by research, but there are ways you can be diagnosed, and we're going to talk about that. So, what are the symptoms? So, hypermobility of the joints is one of the main symptoms of EDS, particularly for, of course, hypermobility, Ehlers-Danlos syndrome. Now, there are rarer types which aren't as well characterized by hypermobility, but in general, if you are not hypermobile, it's far less likely that you have EDS. And this hypermobility can manifest itself in different ways in terms of the joints. So, frequent dislocations or partial dislocations. So I'm going to talk about partial dislocations in a minute because a lot of people don't even know that they've had one or what it feels like. Easy bruising or tearing of the skin. Now, that's essentially because your connective tissue is weaker. So, when you get wounded or you get a cut, or say you have a blood test or your blood taken, your connective tissue is more stretchy, therefore it's going to be harder to heal. Find it hard to heal. Fatigue is a really big symptom of EDS. I mean, to be honest with you, probably don't really know why, but for some reason, having hyperelastic, stretchy connective tissue causes really strong chronic fatigue in a lot of people. Migraines and headaches. And for some people, migraines and headaches are their first sign that they have EDS. It was for me, the thing I suffered with a lot as a child was migraines and headaches. But I was always hypermobile, but it was probably one of the first signs that there was like something else really. And of course, that doesn't mean you have EDS if you have migraines and headaches, but it actually is a very underrated component of EDS. So then body aches as well. And that's often caused by something called muscle guarding, where with EDS, in an effort to try and hold your joints and other parts of your body in place, your muscles might tense up because you're so, loose in a way. So it's kind of like a contradiction. But because your connective tissue is loose, your muscles and other parts of your body might try and compensate and get tenser. So that also happens a lot in other parts of your body, like the bladder, for example, with EDS. So you do get gut and bladder issues too, caused by the kind of, these elastic motions and guarding of the gut and bladder. So you can, it can be sort of GERD, like gastrointestinal reflux disease, or it could be like constipation, diarrhea, cystitis, and dizziness. And that's often connected to another comorbidity of EDS called post-autonomic tachycardia syndrome, which we're going to talk about in a bit, and allergies too, connected to mast cell activation syndrome, which we're going to talk about as well, because that's also connected to EDS. It's a fun package. So, subluxations. Now, subluxations, excuse me, are the fancy word for partial dislocations, right? So some people don't even know that partial dislocations exist because it's pretty obvious generally when you fully dislocated a joint. it comes right out. You probably need to go to the emergency room. With partial dislocations, you may partially dislocate yourself in a joint, and then the joint may return to normal, so you don't really know it's happened quickly. So when you kind of explore on forums and you go on social media and you see people talk about what does subluxation feel like, um, it's often described as a sharp pain in the joint followed by an ache, um, or a popping of in and out of the joint. Well, you may hear a noise as well, and then afterwards, essentially after the sharp pain, after the popping in and out, you're going to have an ache in that joint. You may even visibly see that the joint is slightly moved. Maybe it suddenly gives way. For example, for me, like when I'm walking down the stairs sometimes, I can just be walking, just minding my own business, and then my ankle just sort of like gives way and I get really sharp pain in it. And for me, I feel like that is subluxation, particularly because I have flat feet as well, which is also common in EDS, and bruising around the joint. Now, that's something a lot of people say, particularly if they have subluxations in their knees. So if you're hypermobile and you're noticing you're getting bruising around some of your joints, you may be partially dislocating without even realizing that you're doing it. So these are some lesser known symptoms. Like I said earlier, the bowel is involved. But some people who have GERD or who have, indigestion, IBS, may not realize that that can actually be a presenting factor in terms of potentially having an Ehlers Danlos syndrome. Of course, there are plenty of people out there who have those conditions who don't have EDS, but it's important to know. Translucent skin. Now, translucent skin means your skin is quite see-through, essentially. So you may have very obvious vein patterns on your skin in particular areas, maybe on your legs, maybe across your chest, maybe in the at your hips, in the sort of V-line area. There are different areas where people report that it's more common that they see their veins. For me, I've always had quite translucent skin on my upper chest area. Another important thing to say is that translucent skin is often, when you search it, associated with one of the rarer types of Ehlers Danlos syndrome called vascular Ehlers Danlos syndrome, which is probably the most dangerous, and it's one of the rarer types. However, a lot of people with hypermobility Ehlers Danlos syndrome also have translucent skin, just not to as severe an extent, but they do, and they can have it. Stretchy skin. So stretchy skin, essentially, what you need to do to see, do I have stretchy skin, is just pull some of your skin on your face, to the side, to your neck, on your hand. You can put it up on your wrist. And there are guidelines online about how many centimeters you should be able to pull your skin normally, right? So I can't, I think for the neck, for example, it's around 3 centimeters. You shouldn't be able to pull it more than that. If you're able to pull your skin more than 3 centimeters out from your neck, then you've got stretchy skin. And there are similar guidelines for your hand. Because these are often the areas people test. For me, I've got very stretchy skin on my face and my neck. But for people who have classic Ehlers Danlos syndrome, which is one of the types, there's more skin involvement, and we'll talk about that in a second. So they might have even really stretchy skin on places like their forearm, where your bicep is, and you can just like pull it really far out. Large arm to height span as well. I've spelled height well, so apologies for that, but I think you can know what I'm saying. But large arm to height span is also in the Ehlers Danlos hypermobility criteria. So what that means is basically that the length from you stretch out your arms from side to side, the length from your middle finger to the other middle finger is actually longer than your height, your body height, to a higher ratio. Heart valve issues, again on the criteria, dental crowding on the criteria, and that means that, like, for example, you may need to have your teeth taken out when you're a child, or you have your teeth growing in a way where they are crowding next to each other, and soft velvety skin. So yeah, that is an interesting symptom, and flat feet, like I mentioned earlier. Rarer types. So you got vascular Ehlers Danlos syndrome. Vascular Ehlers Danlos syndrome is one of the most dangerous, if not, well, one of the most dangerous. Yes, I can't particularly say it's the most dangerous. I'm not sure if it is or if it isn't, but because of the fact that the vascular system is involved to a very high extent. So you are more likely to have organ ruptures, aneurysms, or bleeding in your organs and body parts because of the veins being so fragile and in your body and your arteries and things. And your skin is even more translucent. So it's to the point where you can literally see the whole web going on there under your skin. And your skin is very easily bruised. Now, easy bruising is a symptom in EDS for hypermobility and Danlos syndrome, but in terms of very easy bruising, that literally means that someone can sort of touch you or maybe slightly hit you, but not, I don't know how to explain it, sort of like tap your arm or something, by mistake, and you may get a bruise from that, or you may stub your toe and get a really large bruise. Something where the bruising very much does not correspond to the injury. And of course, that does happen in hypermobility Ehlers Danlos syndrome too. But for vascular Ehlers Danlos syndrome, if you're bruising you're going to bruise so much easier. So with classic Ehlers Danlos syndrome, the distinction that people often make there is that there's more extensive skin involvement. So the skin is even stretchier than it is in hypermobility type. And there's often more atrophic scarring. I'm going to show you some pictures of that in a minute. And that's basically like when you get a cut or a wound, the scar is very different and very substantial. So you've got another type called classic-like. So it's very similar sounding to classic. So that involves lots of organ prolapses. And interestingly, that does not involve the joint dislocation as much. Kyphoscoliotic type, scoliosis is the main presenting sort of factor in that type of EDS. Scoliosis is an abnormal curvature of the spine. And people who have this type often have a really strong abnormal curvature of their spine. Cardiovascular type, it's similar to the sense that the vascular system is involved, like in vascular type. However, it's more limited or more extensive in the heart valve and chest area. Muscular contractile type, you're going to have wrinkly skin, really wrinkly skin, club feet, and really weak muscles. You also have muscle weakness and low tone in the myotonic type. With the periodontal type, you're going to have dental issues. And with the dermatopraxis type, again, there's wrinkling, there's sagging of the skin. So some of these overlap because that type overlaps with the muscular contractile type in terms of symptoms. And there's another type called arthrochalasia type. And that involves even more hypermobility than in the other type. So you're extremely, extremely hypermobile. Dislocations are going to happen really frequently, particularly in your hips. So there is a lot of overlap, some in there with EDS, the hypermobility, the main type of EDS, hypermobility, Ehlers Danlos syndrome. But some of them have more distinct features. So let's move on. Look at some pictures of some of these symptoms, okay? So these have been taken from research papers. Now I'm just going to talk through some of those. Now, what you can see in the top left there is someone manipulating their fingers downwards. Now you can also do that upwards, and that's called swanning of the fingers. Shows that there's a lot of hypermobility in the finger joints. Now a similar thing can happen with the toes, so you can sort of stretch them out, you can lift them up and down. And as you can see in the top right there, someone can actually bend their toe back and bend their ankle back too. So what you're seeing with the legs, that person standing there, is that is showing the hypermobility of the knees, because the knees are hyperextending backwards, rather when a normal person, quote unquote normal person, who doesn't have this level of hypermobility stands, their legs are much straighter. Now with the elbow, I have my elbow is like this. When you stick out your elbow, it's supposed to stay at straight line level. People who have hypermobility and hypermobility Ehlers Danlos syndrome often have a sort of situation whereby when it gets to their elbow, their arm moves downwards because there's not as much sort of connective tissue strength around that elbow joint. And the thumb, that's an interesting one as well. There we can sort of stick your thumb into your hand, flat feet being shown there as well at the bottom right, as well as bunions. And here's some pictures of what the Beighton score is. Now I'm going to talk about that more in a moment, because that is part of the diagnostic criteria for EDS. So it's important to do that on yourself and count up your score. So for me, I can do the pulling your pinky back 90 degrees on my left and right side. I can pull my thumb back to touch my forearm on my left and right side. My elbows are hyperextensible on my left and right side, but sometimes they're not as bad. I don't have hyperextensible knees, but you saw there what that looked like. And being able to touch the floor with your hands, as the diagram is showing here. And so the Brighton score is therefore out of 9. But what I will say about that one there, when the person is touching the floor, is that a lot of people with EDS may not be able to touch the floor as time goes on, because their muscles might start getting tenser and sort of, having contractions, and so it's hard for them to do that. So part of the Brighton score and criteria is, were you able to do this in the past? And that can sometimes add a point. So it's important to know that as well. And here's some other pictures. So let's talk about atrophic scarring, and that is in the top right there with the woman's arm and the knees of the individual there. And also on the individuals in the top left, they are stretching out their skin with their eyelids, which you can also see the person at the bottom left is doing the same thing. And so there's a lot of pictures here about stretchy skin. You see it on the neck, you see it on the wrist. So it's just showing what I was talking about earlier in terms of how stretchy the skin can be on different parts of the body when you have EDS. So who gets EDS? So EDS can affect anyone, essentially, because it's genetic. So that means that it doesn't really have a sort of potential lifestyle, element to it. It is genetic, it is inherited. So therefore, anyone of any population can get it. Now, onset of symptoms is usually during childhood or teenagers. But a lot of people don't really notice their symptoms until they get to their 20s sometimes. So, and another thing is that in some interesting research papers, they talk about sort of progress in terms of the development of the symptoms with EDS and how each decade new symptoms arise. And a lot of the time, that starts in childhood as being really hypermobile, just they're bruising really easily, or maybe they have headaches, or they are more tired. And then, adolescence, you may start developing those things even more. You may be even more tired and malaised. You may start developing some of the comorbidities we're going to talk about in a bit, like post-exercise tachycardia syndrome and some allergies. But in your 20s, from what this paper I'm referencing on my head here says, and from what I've read, the chronic pain gets worse in your 20s, or maybe later adolescence, you start developing more of that pain. So, of course, it can happen earlier. And, of course, everyone who has EDS is different. But, that is what some papers have pointed at in terms of a sort of development of the symptoms. Interestingly, there are studies done which show that the ratio of EDS in terms of women to men is 8-1 in terms of assigned female birth, assigned male at birth. So, of course, that is very interesting. Now, the reason this is interesting is because, as I said earlier, EDS is inherited. EDS can affect anyone, right? So that technically means that you are a woman who has EDS, your father may have passed EDS onto you rather than your mother. However, what research doesn't really understand yet is that it seems that more women who have the EDS gene, that is, women who are assigned female at birth, seem to be affected more strongly by EDS, to the point where maybe that just means that there's more records of diagnosis. Now, that's not to say men don't have EDS, but they're trying to investigate why it seems, according to research and literature, that women seem to be more strongly affected. However, that does not mean that there are not men who are also extremely strongly affected by EDS. Of course there are, especially when it comes to the rarer types, because the rarer types, I should have made this clear actually when I said this statistic, this ratio is research into hypermobility Ehlers Danlos syndrome. So when it comes to the rarer types, they haven't really done so much research, but it seems to be more equal in terms of how it affects the different to women and men. But of course, there's so much more research to come. There's so much more that needs to be done into understanding why this is the case. And of course, there's a big gap there in terms of non-cis women, non-cis men, transgender people who are, carrying a gene but maybe don't express the symptoms. There's so much interesting stuff out there. So another thing is that there's no studies done in terms of ethnic populations in who EDS affects more because of the fact that it's genetic. So it can affect any ethnic population. It doesn't really make a difference. So diagnosis. Here we go. So diagnosis for EDS is long. It is long and it is complicated. That's not to say that every single person who's EDS is going to have a really long, tough journey trying to get the diagnosis, but a lot of people do. In fact, the average time to get a diagnosis for EDS is 10 years. 10 years. And that's because, as we've sort of seen, EDS affects so many different parts of your body that you end up kind of going to different departments for the manifestations. So you might have really bad migraines and headaches, and you're like, oh, I'll go to a neurologist asking for the help for those. But then you start developing IBS and you're going to the gastroenterologist, and then you start developing allergies and you're going to dermatologists, and no one's adding these things together. Now, part of the reason for that is because there's definitely not enough awareness out there about EDS right now. It is a rare disease or classed as a rare disease, but I think it's also an underdiagnosed disease. So therefore, there's probably a lot of people out there who have all these different symptoms who don't know this, right? So there's a famous phrase, actually: if you can't connect the issues, think connective tissue. So if you have all of these different things we've discussed, you may have it. However, they will still need to do things to rule out other causes. So blood tests will be involved in that. For rarer types, you can have genetic testing. And if you're developing allergy disorders, that may come back with blood tests in terms of for mast cell activation syndrome, for example, you can just test for tryptase, which is a mast cell component, histamine, immunoglobulin E. These are the allergy type biomarkers in your blood. So those are things which can help contribute towards the diagnosis, as well as scans. So an echocardiogram, for example, might be able to see if you have any heart valve issues, which can be common in EDS. X-ray might be able to see dislocations or hip dysplasia, which is also common in EDS. And MRIs and ultrasound may be able to evaluate similar things, but also organ prolapse too. Now, physical exam is obviously a big part of it because it needs to be able to look at you and see if you're hypermobile, for example, for the hypermobility Ehlers Danlos type. And see what your symptoms are like on your skin and in your body in general. And there are criteria for the EDS most common type, which we're going to talk about in a second. And there are other tests too. So to do with more like devices and sort of more particular tests, like the tilt table test and a 24-hour blood pressure monitor, which assesses if somebody has post-ulcerative tachycardia syndrome, which is a common comorbidity of EDS. So the criteria. So you need at least 5 out of 9 on the Brighton score, I believe, to be considered for EDS. Now, you can have 4, so you might have only matched 4 of those points, but with additional symptoms and additional considerations, you can add another point on to make 5. For example, you used to be able to touch the floor with your hands, or you can do other party tricks, or like you have other hypermobile joints which are not in the criteria. In fact, there's a lot of discussion really about how the criteria needs to change because there's a lot of joints which are missed out on the Ehlers Danlos diagnostic criteria. So you've got the fingers and you've got the wrists, but, it doesn't assess the hips, it doesn't assess the ankles, it doesn't assess the shoulders, for example. So then there's a sort of the next part of the criteria, which is that you need at least 5 of these bodily characteristics. Papules, which are these sort of lumps on your feet, on the base of your feet. When you stand, you should be able to see them. You can Google what they look like. They sort of push out of your skin a little bit. And a lot of people have them, but it's more common in EDS. Stretchy skin, like we've talked about. An arched narrow palate. So dental crowning does come into that, but an arched narrow palate, if you look at the top of your mouth, your palate being the gap between the two sets of your teeth at the top, if your palate is particularly high, so if you look at this on Google, for example, you can see what an arched narrow palate looks like. The sort of diameter of the gap between the top sets of the top teeth shouldn't be super narrow, but a lot of people with EDS have it narrow. And if you've ever had like a retainer or a brace placed into your mouth, you might have the molds, or you might have that retainer still there, and you can actually see the shape of your palate by looking at it, and you can tell if it's quite high or narrow, and you can look it up. So different valve and aortic root issues with the heart, organ prolapses, including pelvic floor prolapse. We spoke about earlier a large arm to height ratio, which has to be 1.05 or above, soft skin, hernias, which can, for example, often be abdominal ones, the scarring, and the positive wrist or thumb sign, which is when you are able to cross your thumb over your hand and fold your fingers over it and still see your thumb. And wrist sign is when you're able to put your thumb and pinky of one hand around the wrist of the other hand, and they're able to overlap each other when you do that. Having a family history of EDS is also no criteria, but it's not 100% necessary to have family history of EDS, right? Particularly when we go back to thinking about how some people, as we were talking about earlier, may have EDS genes, or this is what's really interesting, or have this kind of hypermobility spectrum genetic makeup, but not to really express it as much. You also need to have chronic widespread pain for 3 months or more. So that's pain in your whole body, essentially, or in many parts of your body. As part of that, it does say on the EDS diagnostic criteria, you should exclude other causes of having chronic widespread pain. So that will include like fibromyalgia, rheumatoid arthritis, lupus, and more. But it is important to remember that it's possible to have EDS with other conditions. In fact, research, which I'm going to be talking about towards the end of this video, is suggesting that autoimmune disease, for example, is a lot more common in people who have hypermobility Ehlers Danlos syndrome and EDS than the general population. I have autoimmune disease and EDS, for example. Quite a few people with EDS do. So it's important to think, if you have an autoimmune disease which may cause bodily pain, that does not mean you don't have EDS. However, I would say it probably will end up making it more difficult for you to get diagnosed with EDS. But if you have all these other signs, you have all this hypermobility, you have dislocations, you possibly dislocate, you have some of those signs in your body, like the scarring and the stretchy skin, you definitely should look into it. Now, one thing to think about is HSD. HSD is hypermobility spectrum disorder. Now, there's lots of debates in the medical field about, is it the same as EDS? Is it different to EDS? But it's very similar in terms of the symptoms and the complications and the presentations to hypermobility Ehlers Danlos syndrome. And the majority of research suggests it just affects someone's life as badly. It's equally as severe. Now, some even say it's the same as hypermobility Ehlers Danlos syndrome, but some say that the difference is there's a larger extent of organ involvement in hypermobility Ehlers Danlos syndrome than there is in HSD. However, all of the comorbidities that can arise from hypermobility Ehlers Danlos syndrome can also arise in HSD. So it's quite difficult to understand where that sort of line is and where the line parts. But if you do not have, for example, all of the diagnostic criteria for hypermobility Ehlers Danlos syndrome, saying you don't match 5 of those points for your body, maybe you only have 2, maybe your Brighton score is 4 rather than 5, and maybe you do have another autoimmune disease or something which gives you body pain, you may be diagnosed with HSD instead of hypermobility Ehlers Danlos syndrome. But treatment for HSD is quite similar to hypermobility Ehlers Danlos syndrome. And what are these treatments? Firstly, physiotherapy. Physiotherapy is used for these conditions because it can help improve the strength of your ligaments, your muscles, and maybe reduce dislocations. It is important, however, to note that physiotherapy as a process is going to be very different for somebody who's hypermobile than someone who's not. So making your physiotherapist aware of the fact that you have EDS will be really important. And finding physiotherapists who have an awareness about it might be hard, but they are out there, and they should at least have a general understanding of joint hypermobility syndrome. So pain medication as well. There are things such as pregabalin, gabapentin, And a lot of people take that and it helps their pain, particularly because a lot of people with EDS have widespread chronic pain or neurological type pain in their body. Antidepressants are supposed to work in the same way. And there's another medication called low-dose naltrexone, which a lot of people talk about. I'm not sure if it's available everywhere, but a lot of people say this does help them with their pain. And the ways that you would access these treatments is through rheumatologist or maybe even your primary care doctor. So, for example, your GP may be able to refer you to physiotherapy or prescribe these medications. Surgery. Surgery may be needed for different things, but say if it's for your joints, so you have hip dysplasia or a particular joint problem, a rheumatologist is more likely to arrange that. Antihistamines and mast cell stabilizers, which you can acquire from a dermatologist or allergist specialist, sometimes an immunologist as well, because a mast cell disorder is linked to immune system dysregulation. And if you do have mast cell activation syndrome as part of your EDS, they could really help you because they're essentially reducing the wild activity of the mast cells that's going on. And you can also get medications such as beta blockers and things like that for POTS from autonomic neurologist, and diet and medications for absorption from a gastroenterologist if you have gut problems, or maybe antacid medications. But you need to talk, of course, to your doctors about what's most appropriate for you. And some of these medications you might be able to take if you have other comorbidities or other medications that interfere. So pain management is hard with EDS. Yeah, there are lots of sort of different things that you can potentially do to help yourself. And I'm going to do a video on that as well, more specifically, because that's a very big topic to unpack. Comorbidities, like I said, mast cell activation syndrome. Mast cell activation syndrome is a disorder whereby you, to put it simply, you're allergic to random things and you're allergic to, doesn't work in the same way as a typical allergy. So it's not like you're allergic to nuts and you can't eat nuts. It's more like your body will fire off the allergic signals and the mast cells, such as histamine, will release over much smaller triggers or things that you don't really know you're allergic to or kind of react to. Certain foods, certain smells, certain chemicals. It can literally be anything. That's the thing with mast cell activation syndrome, why it's hard to diagnose, because you don't really have particular allergy, maybe. It's more that your allergy system in your body is dysfunctional. And this is very common in EDS, as well as actually it is common in autoimmune disease too. Another thing that's common in EDS and autoimmune disease and other things is post-orthostatic tachycardia syndrome. That means when you stand up, your heart rate is too fast. So normally when somebody stands up, their heart rate may increase and then sort of stabilize. But when you stand up with POTS, the acronym for that, your heart rate will go up 30 beats per minute or more when you stand up often. Tilt table test can diagnose this. But sometimes you can just take your own measurements at home. What are the measurements of when you stand up and sit down in terms of your heart rate? And bring it to a doctor to assess. The reason that this happens in EDS, at least this is what I think, is because the hyperelastic tendency of your blood vessel means that when you stand up, the blood vessels in your hands and feet find it harder to constrict and they will stay dilated. And so that's stopping your body from returning blood back up to your heart. And so blood may pool in your hands and feet. So I will do 2 other videos for sure on mast cell activation syndrome and post-orthostatic tachycardia syndrome. And to be honest with you, all of these comorbidities, I will do my own videos on in time so that you can explore more what the symptoms are and how to get diagnosed. But they are very connected to EDS and it's very interesting and important to know that. So craniocervical instability, this is a big one really, because essentially what this means is that the ligaments and muscles in your neck are, and it's so common in people with hypermobility disorders, they are loose and they are not holding your neck's not doing a great job of holding up your head, really. And so that can cause all kinds of symptoms and all kinds of problems, because sometimes this means that you may have the back of your brain kind of compressing on the top of your neck. And it's a tough one to treat as well. It's a tough one to treat. Definitely, again, I'll do my video on this, but if you're finding you have a lot of maybe neck pain or you have certain symptoms of craniocervical instability, and you're hypermobile, definitely something to think about with terms of EDS. Hip dysplasia, something which people are actually often born with when it comes to EDS, and sometimes it's not diagnosed till later in life when somebody has a scan. Gastroparesis and GERD. GERD being the reflux issues, and gastroparesis being when your stomach empties incorrectly. Often this means that your stomach is too slow to empty, so you end up having food sitting on your stomach for long periods of time. This is really common in EDS for some reason, particularly hypermobility, Ehlers Danlos Syndrome, and some of the other types. Probably to do with the fact that the gut forms part of the connective tissue in the body and it's dysfunctional. And for the same reason, this is why people can have bladder issues and cystitis. Although if you have mast cell activation syndrome along with the EDS, cystitis and bladder inflammation is very common with that. We've already spoken about how migraine disorders are common, but so are TMJ and osteoporosis. TMJ being the dysfunction of the jaw joint, which often means that, like, when you open your mouth, your jaw might dislocate every time you open it, sort of go in and out, crack and click and pop. And osteoporosis is weakness of your bones density and reduced bone density. Complications. Complications are important to be aware of. If you have heart valve issues or fragile blood vessels as part of the EDS, you are going to have potential heart problems in life, maybe rupturings of the blood vessels or aneurysms. Anaphylaxis if you have mast cell activation syndrome as part of your EDS. Certain infections are more common, particularly urinary tract infections, and organ prolapse and dysfunction as well. So, what is the most recent innovative research on this disorder? Now, this is something I want to do for every condition I do video on, because I actually would like to do a series on different research that's being carried out on illnesses as it emerges, because often you don't know. But so at the moment, the MCAS POTS and hypermobility Ehlers Danlos syndrome being a trio is something which research is beginning to recognize. And if you look at a lot of people who have EDS, maybe advocates, they will often have these two conditions in conjunction. So some doctors who know more about EDS are very much like, yes, you will have POTS and MCAS too, probably. So if you have two of these disorders, but you've not been diagnosed with a third, it's probably worth looking into if you might have the third. Because research is sort of suggesting these three do come as a little package of not so much fun. Autoimmune diseases are also apparently more common in a hypermobility Ehlers Danlos syndrome than they are in the general population. And that's really, really interesting research, because this potentially suggests that there are some phenotypes or genotypes of hypermobility Ehlers Danlos syndrome where immune cell dysregulation is a large component. So this person may have autoimmune diseases, mast cell activation syndrome. And the autoimmune diseases that they highlighted in the EDS conference recently when they did this presentation on this research were things like lupus, rheumatoid arthritis, Crohn's disease, AK, pernicious anemia. There were so many, and it's really interesting to look these things up, because they're finding out more about these things day by day, and hopefully they'll find out more in the future. Small fiber neuropathy is also very common in EDS. Small fiber neuropathy is basically sort of neuropathic dysfunction in the small nerve fibers of your body. So that's different to large nerve fibers, which you may be able to get assessed through a nerve conduction study, but you can't get that assessed, small fibers assessed through that. You'd have to get skin biopsy to find out if you have small fiber neuropathy. But for some reason, the research has been showing that people who have EDS often have small fiber neuropathy. Now, then we potentially explain why some disorders such as gastroparesis or post-hospital tachycardia syndrome arise, because there's often a neuropathic element to those. But of course, we do not yet know. And of course, it would also potentially explain why people who have EDS have a lot of nerve pain. Another really interesting one I came across is that lung capacity influenced by rib muscles may cause problems in EDS, because it means that if you have dysfunctional rib muscles because of EDS, you might find it hard to breathe in, or maybe breathe out, or breathe. And it causes dysfunctions in breathing, and therefore less capacity of your lungs taking oxygen. That's something they've been doing research in. And TMJ and the connection between that and craniocervical instability is also coming out. So if you have TMJ, you're more likely to have cervical instability, craniocervical instability. They've also found that nutrient deficiencies are very common in hypermobility Ehlers Danlos syndrome. Now, this could potentially be due to sort of gut malabsorption problems that are often common in EDS. But of course, more research is developing, and there's certain nutrient deficiencies they found that are more common, and talk about supplements that may be beneficial. And of course, there's always research going on in terms of the best treatments and surgeries, because at the moment, this is a very difficult condition to treat. And it's not a cure, and the treatment is often used to manage pain. So it's an ongoing process. And of course, so is finding the gene for hypermobility Ehlers Danlos syndrome. And they're doing a really big study on it right now, trying to pull together the gene pool of families who have EDS and find what is this gene. Very big study going on right now on the Ehlers Danlos Society in the US. So here's some cool places to check out. Ehlers Danlos Society, like I just mentioned, as well as the Ehlers Danlos Research Foundation, EDS Support UK, and articles such as on Harvard Health and University Health News America on EDS. Now, these are some advocates on Instagram who have EDS. So the Chronic Notebook, which is part of this channel, and myself. Also the Chronic Iconic, Chronically Jenny, Amy Hips Don't Lie, Ria Sick, Life with Stripes, EDS Ella, Ehlers Danlos Boy, GGW Wong, and Genetically Clumsy. All really good advocates to check out on Instagram who talk about their experiences, particularly with the symptoms and sort of how to manage them. So, who are some famous people who have this condition? I want to do this with all the other conditions just because I find it very interesting to see who has maybe come out and spoken about their experience. Jamelia Jamil is one of the main sort of advocates on it. She talks about it a lot on her social media also. And something has affected her a lot. And she is, for those of you who don't know, sort of TV, radio actress and advocate and personality. I'm not sure what these job titles, so that might be a really bad way to describe her. But overall, she's an awesome human being, and you should definitely check out her advocacy. Lena Dunham, also an actress from the UK, and she also has a lot of posts on her experiences with her health, because she has other comorbidities and issues. Although, of course, I can't be sure if they're connected to EDS, but it's interesting to see her talk about those experiences and really helpful for many people. Russell Kane, who is a comedian, and Alyssa Seeley, who is an Olympian. So, that concludes the video. Thank you so much for watching. I know it's been quite long, so if you're still here, thank you. And please, if you do have any questions, add them in the comments, and do subscribe to the YouTube channel. More videos will be coming about loads of different things, different conditions, different aspects of chronic illness and disability, advice on things and accommodations, and seeking a diagnosis. But yeah, you can also check out my other social platforms, and hope you're all having a low symptom day.